I'm Aditi Dubey, and today we travel across a shifting fault line, not of tectonic plates, but of history, policy, and possibility. We are talking about cancer care in Eastern and Western Europe, and why, for too many, geography still shapes destiny. On papers, the European Union is a unified bloc, shared markets, shared regulations, shared ideals. But when it comes to health outcomes, especially cancer, the map tells a very different story. In Western Europe, Germany, France, the Netherlands, Scandinavia, 5 year cancer survival rates are among the highest in the world. Screening is routine, diagnostics are timely, and access to modern therapies is largely guaranteed. But travel east, Hungary, Romania, Bulgaria, Poland, and a different picture emerges. Here, survival rates for many cancers are 10 to 20 percentage points lower, not because treatments don't exist, but because people often reach the system too late or not at all. Let's talk about screening. In Sweden, mammography is a regular part of life for women over 50, but in parts of Eastern Europe, uptake remains low, sometimes under 30%. Not because women don't care, but because outreach is poor, clinics are distant, and cultural stigma runs deep. For colorectal cancer, early detection can mean the difference between a 90% survival rate and a 10% one. Yet organized screening programs are uneven across the East, and many cancers are caught only after symptoms appear, often far too late. Then there is infrastructure. In Western Europe, a cancer patient might be seen by a multidisciplinary team, oncologist, a radiologist, psycho-oncologist within days of diagnosis. In parts of Eastern Europe, wait times stretch into weeks or even months. A lack of trained personnel, outdated equipment, and underfunded hospitals compound the delays. Drug access is another dividing line. New therapies, immunotherapies, targeted drugs, they arrive quickly in the West. In the East, even when approved, they may be out of reach financially or stuck in bureaucratic delay. It's not uncommon for patients or families to travel abroad or crowdfund just to access life saving treatment. But this isn't a simple East versus West binary. Countries like Czechia and Estonia have made significant strides, investing in registries, digitizing records, improving early detection. Poland has doubled down on its national oncology strategy. And Slovenia, with just 2 million people, now boasts survival rates that rival in Western neighbors. What separates progress from stagnation isn't just wealth, it's political will. Investment in public health infrastructure, partnerships between academia and government, between global pharma and local clinicians. And more than anything else, it's trust. Trust that screening is worth the discomfort, that a visit to doctor won't bring ruin, that the state will protect you, not just with borders and budgets, but with the dignity of timely, equitable care. As Europe reimagines is its identity in the 21st century, cancer care may become one of its greatest tests. Can the wealthier nations lift their neighbors? Not with handouts, but with knowledge, collaboration, and solidarity. Because disease does not respect borders, and neither should our compassion. Thank you for listening.